If you're enjoying this Med Prep to Go Step 1 podcast, you can now get the content along with the content of the Crush Step 1 podcast ad-free in one bundle. Just go to medprep2go.com and find our new subscription podcast called Med Prep to Go Step 1 Bundle.
This episode is brought to you by... Oops! I've got a box of Cheez-It crackers staring at me and I just wanted that irresistible cheesy crunch. Sorry, that was a total snacksident. What was I supposed to be talking about? So salty, so crunchy, so cheesy. Whoops, lost my train of thought. I've heard of brain freeze, but brain cheese? I'll just have one more Cheez-It cracker and then I'll get back to it.
Meet the computer you can talk to. With Copilot on Windows, working, creating, and collaborating is as easy as talking. Got writer's block? Share your screen with Copilot Vision to help spark inspiration, and use Copilot Voice to have a conversation and brainstorm ideas. Or maybe you need some tech help. With Copilot Vision, Copilot sees what you see. Let Copilot talk you through step-by-step guidance so you can master new apps, games, and skills faster. Try now at windows.com/Copilot.
Running a business comes with a lot of what-ifs. But luckily, there's a simple answer to them. Shopify. It's the commerce platform behind millions of businesses, including Thrive Cosmetics and Momofuku. And it'll help you with everything you need. From website design and marketing to boosting sales and expanding operations, Shopify can get the job done and make your dream a reality. Turn those what-ifs into... Sign up for your $1 per month trial at shopify.com/special offer.
This is Dr. Ted O'Connell with the Med Prep to Go Step 1 QBank podcast. Today we'll be reviewing 3 pharmacology questions. Just a reminder that you can find these questions and many more at medprep2go.com. If you'd like to get involved in this project or have any feedback, please feel free to email me at ted.medprep2go@gmail.com. If you like what we're doing, please subscribe to the podcast, give us a review, and let your friends know. All right, let's get started with the first question. A 68-year-old woman presents to the office for a routine follow-up visit. She presently does not have any complaints. She was diagnosed with atrial fibrillation 5 years ago. She denies any shortness of breath, palpitations, or chest pain. She is currently taking diltiazem and warfarin. Since last week, she has also started taking a liquid herbal extract of St. John's wort to help her lose weight. Vital signs are 36.4 degrees Celsius or 97.5 degrees Fahrenheit. Blood pressure 126/71 millimeters of mercury. Pulse 89 beats per minute and respirations 16 per minute. Physical examination reveals no significant abnormalities. Which of the following is a mechanism by which the herbal extract is most likely to interfere with the patient's anticoagulant medication? A, competitive inhibition at the medication's binding site. B, decreased intestinal absorption of the drug. C, increased hepatic metabolism of the medication. D, increasing renal metabolism of the medication. Or E, inhibiting enzymatic conversion of the drug to its active metabolite. The correct answer is C, increasing hepatic metabolism of the medication. 2 important components of the long-term management of atrial fibrillation include anticoagulation and rate control. Long-term anticoagulation is prescribed to reduce the risk of stroke or peripheral embolism. Commonly prescribed anticoagulants include vitamin K antagonists, such as warfarin, which this patient is taking, factor 2A inhibitors, such as dabigatran, and factor 10A inhibitors such as apixaban, edoxaban, and rivaroxaban. Rate control therapy aims to maintain a normal heart rate. This patient is on diltiazem, which is a non-dihydropyridine calcium channel blocker. This patient has started consuming St. John's wort, an herbal extract purported to have many medicinal effects. This herb is also claimed to be effective for weight loss, although clinical evidence for the same is inconclusive. St. John's wort is an inducer of the cytochrome P450 system of enzymes present in the liver. Many drugs, including warfarin, are primarily metabolized by the cytochrome P450 enzymes. Hence, induction of the cytochrome P450 enzymes by St. John's wort will lead to increased metabolism of warfarin, reducing its anticoagulant effect. Answer choice A, competitive inhibition of the medication's binding site, is incorrect. Warfarin binds to and inhibits the enzyme vitamin K epoxide reductase. St. John's wort has a distinct mechanism of action. It acts as a serotonin reuptake inhibitor. Answer choice B, decreasing intestinal absorption of the drug, is incorrect. St. John's wort is not known to reduce the intestinal absorption of drugs. The calcium in milk can bind to tetracyclines and hence reduce its intestinal absorption. It is thus recommended that these two not be consumed together. Another substance that can bind to and reduce the intestinal absorption of drugs is activated charcoal. It is sometimes administered orally or via a nasogastric tube in drug overdose patients to reduce further intestinal absorption of the drug. Answer choice D, increasing renal metabolism of the medication, is incorrect. Warfarin is almost entirely eliminated by hepatic metabolism, and only a minimal amount is excreted by the kidneys. Answer choice E, inhibiting enzymatic conversion of the drug to its active metabolite, is incorrect. Warfarin is administered in its active form and does not require enzymatic conversion in the body to exert its effect. Drugs that do have this requirement are called prodrugs, such as enalapril and levodopa. The key learning point here: warfarin is an anticoagulant medication metabolized by the cytochrome P450 enzymes present in the liver. Simultaneous administration of cytochrome P450 enzyme inducers, such as St. John's wort, can increase the hepatic metabolism of warfarin, thereby reducing its anticoagulant effect. Question 2. A 67-year-old man presents to the emergency department with sudden onset of palpitations, shortness of breath, and dizziness, which began 30 minutes ago. He has had similar episodes in the past, but not as severe as this one. The patient reports that he has type 2 diabetes mellitus, which is well controlled, and hypertension, which is not currently being treated with medication. Blood pressure is 160 over 88 millimeters of mercury, and heart rate is 140 beats per minute. Other vital signs are within normal range. Laboratory tests and an electrocardiogram are ordered, and the patient is diagnosed with atrial fibrillation. While discussing treatment options with the patient, he asks about warfarin side effects and drug interactions. Which of the following will increase the risk of bleeding with warfarin? A, alcohol, B, carbamazepine, C, modafinil, D, phenytoin, or E, rifampin? The correct answer is A, alcohol. Cytochrome P450 is a group of hemoprotein enzymes that are involved in many bodily homeostatic functions, including drug metabolism. Alcohol in acute use can inhibit cytochrome P450 enzymes and thus decreases warfarin elimination from the body. This results in increased warfarin levels in the blood. Answer choice B, carbamazepine, is incorrect. Carbamazepine is one of the cytochrome P450 inducers, which means that it increases the expression level of cytochrome P450 enzymes, resulting in increased metabolism of warfarin and subsequently reducing the therapeutic level. Answer choice C, modafinil, is incorrect. Modafinil is a cytochrome P450 inducer like carbamazepine. Answer choice D, phenytoin, is incorrect. Phenytoin is an anti-seizure medication that increases cytochrome P450 enzyme activity and reduces the therapeutic level of warfarin. Answer choice E, rifampin, is incorrect. Rifampin is an antibiotic that is known as a cytochrome P450 enzyme inducer. The key learning point here, cytochrome P450 enzymes are a group of mostly liver enzymes that metabolize medications. Their action can be enhanced or inhibited by different chemicals, resulting in altered therapeutic dosages of many medications, including warfarin. Alcohol inhibits cytochrome P450 enzymes and decreases warfarin elimination, leading to increased warfarin levels in the blood and a greater risk of bleeding. Question 3. A 19-year-old man presents to a psychiatrist for a follow-up appointment for generalized anxiety disorder, GAD, and major depressive disorder, MDD. Medical history is otherwise unremarkable. His generalized anxiety disorder and major depressive disorder were unresponsive to adequate trials of 2 different selective serotonin reuptake inhibitors, SSRIs. So the psychiatrist decided to start a serotonin norepinephrine reuptake inhibitor, or SNRI, at the previous visit. Today, the patient reports improvement in generalized anxiety disorder and major depressive disorder symptoms, but he states he is having trouble achieving erections. He did not experience the side effect with either of the SSRIs. Review of systems is negative. Physical examination is normal. Which of the following changes in intracellular ion concentration in smooth muscle is most likely leading to erectile dysfunction in this patient? A, decreased Ca2+, B, decreased magnesium 2+, C, decreased sodium 2+, D, increased calcium 2+, or E, increased sodium plus. The correct answer is D, increased calcium 2+. Smooth muscle contraction causes vasoconstriction, which opposes erection. During tumescence, nitric oxide increases guanosine 3,5 cyclic monophosphate, or cyclic GMP. Cyclic GMP causes smooth muscle relaxation, which in turn causes vasodilation of blood vessels in the corpus cavernosum, causing erection. Erectile dysfunction is commonly experienced with SSRIs, but it can also occur with SNRIs. Norepinephrine increases intracellular calcium concentration in smooth muscle, causing smooth muscle contraction that opposes erection. Answer choice A, decreased calcium 2+, is incorrect. This occurs in the normal physiology of an erection, not in erectile dysfunction. Answer choice B, decreased magnesium 2+, is incorrect. This could cause excitotoxicity in neurons, but is not involved in smooth muscle contraction. Answer choice C, decreased sodium plus, is incorrect. Opening of L-type calcium channels, not sodium channels, triggers depolarization of smooth muscle cells. Answer choice E, increased sodium plus, is incorrect. Opening of L-type calcium channels, not sodium channels, triggers depolarization of smooth muscle cells. Increased intracellular sodium occurs in cardiomyocyte depolarization. The key learning point here, in male erection physiology, a decrease in intracellular calcium causes smooth muscle relaxation, leading to vasodilation. Norepinephrine interferes with normal erection physiology via increased intracellular calcium concentration, leading to smooth muscle contraction. Okay, that's the end of this episode, but please do check out our other episodes as well as all of the content available online at medprep2go.com. Hi, everyone. This is Ted O'Connell. I just want to let you know that we have launched a Step 2 QBank podcast, very similar to our Step 1 QBank podcast. Each episode will have 3 questions so that you can study on the go. We are actively recording these and plan to release a new episode every 2 weeks. We're also launching a premium podcast bundle that will include ad-free access to USMLE Step 2 Secrets podcast, as well as early and ad-free access to all of our episodes from the Step 2 QBank podcast. So please go over to our website at medprep2go.com and check these out, or you can access them wherever you get your podcasts. Thanks so much.